The Caribbean Authority for Accreditation of Medical Education and Other Health Professions is urging greater investment in primary health care in Jamaica. Chairman Professor Trevor McCartney argues that strengthening community-based healthcare services is critical to reducing pressure on hospitals and improving overall health outcomes. Alia Bryant reports.
At the Medical Association Annual Awards Banquet, Professor Trevor McCartney called for greater investment in healthcare while highlighting the Caribbean's success in training medical specialists. Professor McCartney, chairman of the Caribbean Authority for Accreditation of Medical Education and Other Health Professions, stressed the importance of maintaining high standards as medical professionals move more freely across the region.
A significant number of our doctors in the Caribbean were not being trained by the traditional University of Guyana, but trained in offshore schools, China, Russia, Europe, and Mexico, and Cuba. And therefore, we had no idea whatsoever of the quality of persons who were getting from the institution. So I developed an exam that would assure the public that the standard of healthcare being delivered by these individuals was commensurate with what they are accustomed to.
He said accreditation and quality assurance remain critical to strengthening the Caribbean's healthcare workers. Now, according to Professor McCartney, stronger community-based services can help prevent illness and reduce pressure on hospitals.
Everybody talks about hospital care and you talk about challenges in hospitals. Yes, hospitals need food, they need preventive maintenance, they need equipment, they need supplies and so on. But we want to prevent the people getting there. And therefore the primary care system needs to be supported, encouraged, and improved, right? And myself and late Dr. Dennis Duncan did a redesign. It was recognized internationally, and we have got $150 million to support that program. And we're asking all our colleagues to continue to fight because primary care does not make the headlines.
Professor McCartney noted that healthcare workers in community clinics continue to make significant contributions that often go unrecognized. His remarks come amid ongoing regional discussions on healthcare funding, workforce development, and improving access to quality medical care.
Hospital, somebody goes hospital and don't get through. People sitting on the bench, all those things don't get through. That's what makes it like. Not that the tremendous job that those people do. I learned something when I had to do for IDP. I went into Chapelton and Shannon Bush. And when I saw the response of the public to the clinic performance by the doctors, the people are appreciative and need more support. And that's where I think we should pitch a significant part of our work.
Aliyah Bryant, TVJ News.
We head to a break. More stories when we return. Welcome back to the Midday News. 4 new courthouses will be built in St. Elizabeth, Westmoreland, St. Anna, and Trelawney on the National Reconstruction and Resilience Authority program. Speaking with journalists in St. Thomas recently, Justice Minister Delroy Chuck said the expansion forms part of a broader effort to modernize the justice system.
It's going to be one of the best courthouses once it opens. Obviously, we hope others will be as good or better. But the problem is not only we have to work with the courts as to where the courts should be. And in working with the courts, where courts should be, how the judges should get into the courts. Everything as about the configuration of the court has to be with the judiciary.
The minister added that the rehabilitation of outstations is being addressed, particularly those that currently share space with police stations. In the meantime, Mr. Chuck expressed concerns about allegations of misconduct involving some justices of the peace. He's again calling on JPS who are unwilling JPs who are unwilling for or unable to properly carry out their responsibilities to voluntarily step away from the role.
Do not collect a fee. I'm tired of telling Jamaicans JPs must not collect a fee, and if you know any JP who is demanding money for their service, let us know. If you can't serve voluntarily, withdraw. So that's the main challenge we have, and unfortunately it's been done by a few JPs who may have fallen into hard times.
It's now time for the Business Minute.
The Jamaica Stock Exchange, JSE, has confirmed that it is managing a cybersecurity incident which resulted in some personal information being accessed without authorization. In a statement today, the JSE said the breach was recently identified and contained, and that an investigation was launched in cooperation with the relevant authorities. The stock exchange said investigations have confirmed that some personal data was affected. However, it stressed that there is no evidence the incident compromised its trading or settlement platforms, customer login credentials, or core transactional systems. The JSE says it has reported the matter to the appropriate authorities and is directly contacting affected individuals with guidance on steps they should take. Further afield, oil prices hit a 3-month low Monday after the US and Iran reached an agreement to end the port blockade and reopen the Strait of Hormuz. Global and US oil benchmarks both fell around 5% to their lowest levels since early March. They're down around $10 a barrel over the past week. However, crude prices are still higher than before the US and Israel launched attacks on Iran in late February. Oil analysts say it could take many months for them to return to pre-war levels. And that's it for the Business Minute. I'm Prince Moore.
Time now for the top stories from around the world.
In the region, the Haitian Bridge Alliance has welcomed an executive order signed by Maryland Governor Wes Moore establishing an immigrant rights protection task force. The 12-month initiative is designed to protect immigrants from fraud, exploitation, and discrimination. Moore says immigrants are vital to Maryland's economy and pledged to safeguard their rights, while the advocacy group praised the move as a strong step forward toward ensuring dignity, safety, and accountability. And on the international scene, a massive overnight Russian missile and drone attack on Ukraine's capital has killed at least 4 people, injured more than 20 others, and set fire to the historic Kyiv Monastery, a UNESCO World Heritage Site. Firefighters battled flames at the centuries-old religious complex as officials assessed the damage. The strikes also sparked fires at other cultural sites and knocked out electricity to about 140,000 households in northern Kyiv. Russia says it targeted defense industrial facilities in Kyiv and other Ukrainian cities, while Ukrainian leaders condemned the attack as another assault on the country's cultural and religious heritage. And those were the top regional and international stories. I'm Aaliyah Bryant.
We head to our final break. When we come back, we'll have your midday sports report.